My name is Jeannie. I'm a physical therapist with over 25 years of experience helping people to move well, feel well, and be well. Super excited to be here today, and I have special guest Sarah with me.
Hello.
And we are going to be talking all about ACLs, what to expect after ACL surgery. So at least once a month, I'd like to have a special guest on this channel, whether it be another physical therapist or a patient, so that we can talk about the patient perspective. So I've seen thousands of patients with all sorts of different injuries over the years, but I have not had the experience of having those surgeries myself. And I want to be able to help you viewers out there who are going to be experiencing these injuries to know exactly what to expect after surgery. So are you ready to talk ACLs?
I'm ready.
All right, we'll be right back. So welcome back. We are here again talking to Sarah about what to expect after ACL surgery. So Sarah, tell us a little bit about what happened, how you tore your ACL, when you had surgery, all that kind of fun stuff.
Okay, so I tore my ACL while playing volleyball. It was a pretty routine hit. I didn't think that I landed any differently, but pretty immediately upon landing, it felt as if my entire knee went to the outside. It almost felt like just the kneecap, but somehow I think you feel the pop inside of you and you just know something is different. The swelling was quite immediate as well, and I knew very quickly I could put no pressure on my leg. So as an athlete, I kind of knew, I think this is a little bit different of an injury. I was extremely bummed. It was our championship game. So my first thought was just get off the court. I was really hoping that it wasn't going to be what I thought it was, but like I said, it ballooned up quite quickly. It was not too bad of the pain, it's just something that's very deep. You know it's something a little bit deeper than normal. So my first thought was, oh no, there goes the rest of the season, and I hope my team won, and they did. And then after that, I pretty immediately the next day saw a surgeon, confirmed it was the ACL, and then I had surgery at the end of January.
Wow, okay. So how did you get through that initial phase between, okay, I tore my ACL, now I have to have surgery. How long in between was it?
It was about a month, almost a month and a half.
So what did you do during that time to help to prepare for surgery?
So for the first week, I still just kind of had to rest, ice, elevate, like way more than you would think. I was really committed to elevating my leg and icing. And then after that, my surgeon suggested starting physical therapy before surgery as the best possible chance to recover quicker after surgery. So quite immediately, I came to see Jeannie, and she's great. And we started doing PT 3 times a week in the beginning. So I had about a month and a half of physical therapy 3 times a week, a lot of icing, a lot of elevating.
So folks, that's super important. That's one of the best things you can do while you're waiting in between, is to try to get, first of all, your motion back as much as you can before surgery, and try to get that quad to fire again. Try to get it as strong as you can. That's going to be one of the most important things that's going to help you to succeed with your rehab and physical therapy. Okay, so now you've had your surgery, and let's be honest, surgeons are awesome. They're great at what they do, but most of the time people are not really prepared as to what to expect after you've had surgery, those first 48 hours. So Sarah's gonna keep it real for y'all so you know what to expect. So tell me a little bit about that.
I also want to note, I had never had any major surgery prior to this, so I felt like I might have been a little more ignorant than most people even to that. So I did pay quite a bit of attention. So the first thing I did was ask any questions I thought I needed to know with the surgeon beforehand, as well as Jeannie, so that I knew what to expect and I knew what was normal versus not normal, so I could watch myself following surgery. So the day of surgery, everything's a breeze. You wake up and you don't feel anything. You have a nerve block. and that's something you really need to pay attention to. I had never had that before, and so you don't feel any pain, but you also have very little control over your leg. So remembering that that's the nerve block and not necessarily your leg in its entirety. So the first thing is just to get in the house. Remember, you're gonna be in a locked brace. You're gonna be completely covered up like a mummy. You need to get help through your house. I set up on the first floor, so I didn't have to use stairs. Just preparing as well as I could for when I got home. And then again, get ready to be propped up and icing and elevating for probably the first 2 days. Even getting to the bathroom can be a bit difficult.
Sure.
You really need to plan for those things. Food, the kitchen and the bathroom proximity are very important. But overall, staying on top of the medications you're giving and kind of let yourself relax, watch some Netflix. It was a bit more relaxed than I thought it would be, actually.
Sure.
Don't believe all the horror stories you hear. You know your body, and just take care of yourself and follow the instructions that you get after surgery.
Yeah, that's great. And what you might find too, Sarah didn't have a lot of bruising, but sometimes you can have a lot of bruising, and that is normal. You might see quite a bit of swelling in there. That's normal too. Initially too, when you first wake up, you're gonna have an ACE wrap wrapped around your leg to help to control with the swelling. You're also gonna have what we call this wonderful iron brace, which Sarah is going to show you how to actually use it, because you're going to wake up with it, and a lot of times they go over instructions when you're kind of still recovering, which any of y'all who had surgery out there, you have no idea really what's going on. You don't even remember for a while after you wake up. So you're not going to really remember how to wear this brace. So initially you'll be wearing the brace locked in that straightening position. The reason that you need to do that, partially is because you have that nerve block, but also because your quad is not going to know how to work again. You'll be amazed. It does not matter how strong of a person you are with like an amazing quad before, you could be quadzilla. After surgery, your quad does not know how to fire, because even if you have just 5% of swelling in that knee joint, it shuts the quad down and it doesn't know how to work. You can stare at it, you will tell that quad to work, and the thing will not work. So if you go to stand on it, that is one of the things. You'll also be using crutches for the first little while. We're not going to go over how to use crutches in this video, but I do have a Crutch 101 video that you guys can check out, just to teach you how to measure for crutches, how to use crutches on stairs, all that kind of jazz. But most of the time after ACL surgery, as long as you haven't had your meniscus repaired, you're fully weight bearing. Weight bearing is tolerated with the crutches, with the brace locked in extension to protect you until you can get your knee to actually fire. So I'm going to ask you, Sarah, now, if you don't mind just demonstrating how to put the brace on to show people how they're able to do that.
Wonderful. Okay, so I had also never had one of these. So as Jeannie said, I got kind of a quick rundown, and it did take me a couple tries, so please don't feel bad if it does. So it'll be on you after surgery, but you will need to take it off. It has an opening at the front. This top section actually needs to go pretty high up on your thigh. I did not realize that at first. So the key is these little circles here need to line up with the middle of your kneecap. So you'll line it up. These come in varying sizes to fit you. These straps here you'll undo, click on this side, and then you tighten it to fit, and you want it to be quite snug. So there's Velcro on this side, and you do that all the way down. You don't have to worry about it not being locked, because it will be at that time. So you'll just move down, fitting it to the size of your leg, which will also be large after surgery from the ACE wrap. And there you go. You
Perfect.
are fit.
Awesome. And one other thing that to mention as well is you'll see that the brace is locked in extension. You're actually going to keep that brace locked in extension at least for the couple weeks after surgery, because what we don't want to happen is any kind of scar tissue to get in the notch of where that was reconstructed. So keeping it locked in that extension is going to help to keep that so that it doesn't happen when you're sleeping. Okay, so we are going to move on to what to expect in your first 2 weeks of physical therapy, at least the first day, as to what exercises you can plan on doing. We'll be right back. Okay, so here we are. Sarah's on her first day of rehab. And we are going to be talking about what to expect on your first day. So most important after ACL surgery, two things we want to try to, well actually three things we want to work on. One is trying to control the swelling, because the swelling is what shuts off that quadricep muscle. So Sarah kind of talked about how much you got to ice and elevate, super important. You might have electrical stimulation too when you're in therapy to help with some of that swelling as well. Secondly, we have to get the range of motion. Thirdly, we want to get this quad to fire. So right from the get-go on our very first day, it kind of goes in phases of what you can do. So first, we start with what's called a quad set. So basically what you're going to do is just trying to tighten that muscle and bring the back of your knee down into the bed. You're just trying to wake up this quadricep. Now sometimes when people do this exercise, it can help to actually sit up and look at it for some reason, or use your other leg to help you try to figure out how to do this. So I'm going to try to zoom in a little bit and see if we can get you a better picture of that quadricep. But just so you can see, we want to try to get the back of that knee. Whoops, that's a little bit too far. There we go. Kind of tightening, and you can see the quadricep just tightening right there as she's doing it. That's exactly what you want to do. You can do these exercises without the brace on. Okay, then another exercise that we'll do, and we can add this on to our quad set, is actually a straight leg raise. So now what you'll do, and actually don't be surprised if the first time you try this, you're not going to be able to do it because the quad is just not going to be strong enough. Some people will say to keep the brace on, but I have found over the years brace is just too heavy. It's too hard to keep the brace on. So you're going to do your quad set first. Super important that you tighten that muscle first. Then you're going to lift that leg up. So if you need assistance the first few times to do that straight leg raise, you can just have someone assist you while you're doing it. The really important part is that we don't get a lag, and a lag is where your knee kind of bends as you're doing it, so it has to be rock solid straight. If you're not able to keep it perfectly straight, then you gotta have someone assist you with that. And you can actually end up doing this straight leg raise in all four directions. So you can do it on your back, you can do it on both sides, and you can do it on your stomach as well. And again, the key is trying to keep that leg as straight as possible. So expect that you're going to do all of those exercises. Next, while she's on her back, we'll have her do a heel slide. So normally you can take your shoe off so that you'll be able to slide along the bed a little bit easier. But typically, you know, this is great. Sarah, how long has it been since your surgery? Yeah, so Sarah's got fantastic range of motion. When you first go to do this, your leg's not going to move too much because of the amount of swelling and everything, and that's okay. Expectations for the first 0 to 2 weeks, we want to get you to 90 degrees of knee bend. At about the 4-week mark, you want to be between 110 degrees and 120, just to give you some guidelines. We don't really stretch it into that bending because we don't want to interrupt the reconstructed ligament. So it's kind of what you can do, but those are some guidelines for you. Now, oftentimes what can happen is people have difficulty getting the leg straight, and that is the most important thing because our quad cannot fire efficiently if our leg can't be straight. So if you're having difficulty with getting your leg straight, we're going to show you something you can do where you'll just lie on your stomach and do what's called a prone leg hang. So we're going to demonstrate that right now. Okay, so pretty easy when you're on your bed at home. Hopefully it's high enough for this exercise, but you're just going to scoot yourself off so that you're not where your incision is. You're just going to let gravity let that leg hang down. You can keep it there for about 2 minutes and just kind of hang out and try to get that to go as straight as possible. Another one you're going to do is to stretch out that hamstring and your calf muscle to make it easier for you to be able to put that brace on and off. Because again, it's going to be locked and kept in that extension. It really depends on what kind of quad strength that you have. Everyone's a little bit different. So it might be 10 days, it might be 3 weeks. It's really up to how well your quadricep is firing. It has to be strong enough to be able to hold you to unlock the brace while you're walking. Expect to be on crutches. Again, probably 3 to 4 weeks or so. Just again, depends on how quickly that quad comes back. So, stretching for your calf muscle, go ahead and put your leg up there. You can hang the one leg down off the side. And you can grab a bathrobe belt, that works just as good. And then you're just gonna pull it up. And what you will find is you wanna stretch this and hold it for 30 seconds, 3 to 5 times, which is a long time, but that's what you really need to hold a stretch for to get that effective lengthening. So you'll hold it for 30 seconds, that gets your hamstring a little bit and gets your calf muscle. Another exercise that you can expect to do, we probably won't demonstrate because it's pretty straightforward, but any weight-bearing exercises initially you're gonna have your brace on for. You'll have the brace on and you can do heel raises as well. So you're probably gonna do those the first day too. Can you think of anything else that we might have covered on that first day?
No, you'll do that a lot. You'll do those exercises.
Do those exercises. Of course, your therapist is going to do a lot of soft tissue work initially too to help to control the swelling, as well as try to loosen up that myofascial restriction within the muscle tissue to get you ready to be able to move it easier. You might even be able to go on a bike as well, as soon as you get that full revolution, or just going back and forth to get that range of motion. And what about pain medication? Did you have to take pain medication when you came to therapy?
I did not. By that point, 2 days after surgery was, I think, my first day of PT with you. I had just started to get off it, and with the icing very consistently, the icing I think was key, I was able to come to therapy without using pain medicine.
Awesome, perfect. But sometimes you do have to use those pain meds, so it's okay to use them while you're coming in to the therapy to be able to do the exercises you need to do to get everything stronger. All right, well, we're gonna come back for a little wrap up in just one moment. Okay, so Sarah, if you can share with us what helped you throughout this whole process, obviously having a major injury, not being able to play your sport, not being able to do the things that you like to be able to do, what helped you get through that?
So the first thing that really helped me get through it was understanding and accepting that this was going to be a long process. It's easy as an athlete to think you can jump right back in. Unfortunately, that's not the case. I wanted this to be a one and done, which meant I need to take the time to recover before I get into something like sports again. So the biggest thing is accepting what you cannot control, and then working towards what you can control. So I've shared this with Jeannie before. I was extremely surprised and happy to realize that during ACL recovery, you have so many milestones. They might be small. It might be the first time your brace is unlocked, or you don't need crutches to go to the bathroom, or I can bend my knee more than the day before. So celebrating every milestone is what got me through it, and giving yourself a kind of a pat in the back, because it's hard. It's hard to recover, but if you stick with it and do your exercises, you'll see a lot of happy moments too.
That's awesome. And it's okay if you have those down moments.
Yeah.
That is natural to have those. So, don't get overwhelmed by them, and accept that it's okay to feel sad, it's okay to cry. We've had people cry all the time during therapy, and that is all right to express those emotions to help you get through it.
Yeah, definitely.
All right, so any final thoughts that you can think of?
Especially for athletes, do not forget this is temporary, and you can use this time to yourself to come back stronger than ever.
That's awesome. And be realistic too, folks. Make sure you don't go back too early. Research recently shows it's a good 10 to 12 months before you should return back to your sport. But at this time, there's lots of other things that you can continue to do to get you prepared to return to your sport. All right, well, I would like to thank Sarah for joining me now doing this episode on what to expect during ACL surgery. And I want to thank all of you for watching us today and hopefully learning something so that you won't be so scared the next time that you do have to have surgery. All right, so we're going to bop out of here?
We gotta bop out.
Okay, we're bopping out. Here we go, guys.